Okay, so today we'll go to the Aushadha Matra. So, Aushadha Matra means the posology wherein the action of the drug or the procedure-based therapy, it is always influenced by the Matra. So, in Ayurveda, when we prescribe a drug, the action will be depending on the dosage. Not only in Ayurveda, in every concept, it's the same. So in Ayurveda, the dose depends upon the aim of the treatment. In the sense, what aim, like whether it is a shamana or whether it is a shodhana, whether it is used in the form of a purva karma or whether it is used on the form of a paschat karma. For Shodhana, the Grida we have to give the for the Virejana we have to give a dose of, like for example 24 grams. In case of an adult, Avipatti Jurna we have to give us 50 grams if for a Virejana concept, whereas for the Shamana concept we can give 15 grams. So that is the difference. Okay, so how you how the aim of treatment, according to the aim of the treatment, you have to prescribe the dose. Okay.
Yes, ma'am.
Then according to the kalpana, in the sense according to what type of therapeutic forms you are going to give, whether it is in the form of snehana, whether it is in the form of churna, whether it is in the form of arishta. So according to the kalpana, we have to the dose will be dependent on the kalpana dosage when compared to the children. The nature of drug used. The nature of the drug used in the sense, like the churna also, for example, Trivrit churna, if you're going for Trivrit, Virejana, according to the nature of the, according to the condition of the person, we will the Abhipatti churna dosage will be comparatively less when we compare with the Trivrit churna, because Trivrit is little more Virejana. Am I right?
Yes, ma'am.
Okay, the nature of the disease, according to the form, whether it is a Madhyama or whether it is the Avara, and in that form, the nature of disease, the dose should be differentiated in that form, as well as the bell of the patient, how the patient can withstand the action of the drug. In that basis also, the dose will be depending on the bell of the patient too, okay?
Yes, ma'am.
According to the, so posology according to the Sharangadhara. So according to Sharangadhara, you know the reference, Sharangadhara Samhita, Sharira Sthana, 6th chapter, 14 to 16th sloka. Okay?
Please, ma'am, Sharendra.
Sharangadhara Samhita,
Yes,
Sharira Sthana,
yes, ma'am.
6th chapter,
Yes,
14th to 16th sloka.
Yes, ma'am.
Balasya, so the slogan goes like this: Balasya pradame masi, deyam bishvaishaja rettiga, deyam beshaja rettiga. That is, the dosage in the first month is to be given as 1 reti. 1 reti. Last time I told how much is 1 reti?
Ma'am, 1 reti.
Do you remember? Last time I had mentioned, I hope.
Yes, ma'am.
125 mg. Okay.
Yes, ma'am.
Okay, so Balasya Pradame, for the in the initial month, you have to give 1 reti as a dose. Balasya Pradame Mase Deyam Beshaja Rettiga. Vardayitvad Egegam Yavat Bhavadi Vatsara. That is, this dose is increased by 1 reti in successive months up to 1 masha. That is, up to 1 year, it should be given as the dose should be increased as 1 reti, and so how much it will reach? It will reach as the 12 up to the 12th month. We will be giving we will increase, and when it reaches in 12th month, it will reach as 2 masha. It's not 1 masha. 12th month, it will reach 2 masha. Okay, so माशेर वृद्धे तत् ऊर्ध्वं स्यात् यावत् षोडशवर्षिकम्. Again, it should be increased by 1 masha up to 16 years. So the total amount by 16 years, the dosage will be 17 masha. 1 masha equals to 1 gram. Okay.
Yes, ma'am.
That is, it is actually equal to 8 rati. 1 masha is 8 rati. You have learned in Vaishajya, I hope.
Yes, ma'am.
So 2 masha. So when it is up in that 1 year, the dosage will be 2 masha. That means 32 grams. And then again, it will be increased up to 17 masha. Okay.
Yes, ma'am.
Next, according to Susruta Sharira. So once more, I'll say the sloka. Balasya pradame mase deyam beshaja rettikam. That is 1 month. It should be given as 1 rati. Vartayotvad egegam. 1 by 1, it should be 1 rati. Increased by 1 rati. Yavat bhavati vatsaram. Up to 12 years. Sorry, up to 12 months. Masher vrutte tat urdvam syat. Yavat shodasha vatsaram. Up to 16 years, it should be increased by 1 masha. Tataha stiram bhaved va yavat varshani saptadihi. After that, it will be stable. Stiram bhavedatvad varshani yavat varshani saptadihi, up to 17 years. So that is the dosage. Okay.
Yes, ma'am. Please tell me, sir.
According to Sharon.
Yes, ma'am. So, reference, ma'am.
Sharangara Samvida Sharirasthana, 6th chapter, 14 to 16 sloka. Okay.
Yes, ma'am.
Coming on to Susrudas. Tatra Masad, we had explained it on the last class. Tatra Masad Urdhvam, Shirapaya Anguli Parvad, Vayagrahana Samvidam, Aushada Matra Vidatyad, Kola Asti Samvidam, Kalka Matra, Shira Annadayo, Kola Samvidam Annadayo. So for Shirava, that is reference is Shushruta Samhita Sharirasthana, 10th chapter, 38th sloka. Okay.
Yes, ma'am.
Should I repeat once more?
Yes, ma'am.
Reference is Sharirasthana,
10th verse.
38th sloka, in which the 10th.
Yes, ma'am.
10th chapter, 38th sloka.
Yes, ma'am.
In which it is said Anguli Parva Dvayam, that is a pinchful. For Shirapa, it should be a pinchful. For a Shira Annada, it should be of Kolasti Matra. So last time we had a doubt. What is the amount what will be the approximate dosage as Kolasti Matra? So Kolasti Matra, it is equal to 280 milligrams. Okay, Kolasti Matra, it is equal to 280 milligrams.
Yes, ma'am.
That will be the dosage for Shira and Nada. Kola Samhita, that is Kola itself. Kola Matra, that is 1 gram. Okay?
Yes, ma'am.
So, according to Susruta, Tatra Masadurdam, Shirabayam Anguli Parva, Dvayagrahana Samhidam, Aushada Matra Vidatyada, Kolati Samhidam Kalka Matra, Shira Anyadayam, Kola Samhidam Annadayo Idi. Okay? Then, according to Kashyapa Samhita, we had previously learned a sloga last day when we were taking Lehana Dhyaya, wherein it is said, Vidanga Bala Matrantu, Jada Matrasya Dehina, Beshajam, Madhu Satpipyam, Madiman Anukalpayet, Vardamanasya Tu Shishor, Mase Vivardayet, Ada Amalaga Matrandu, Param Vidvat Navardayet. Okay?
Yes, ma'am.
Wherein we have the dosage will be according to the age and the physical condition of the individual. So for a newborn, it is 1 vidanga. 1 vidanga in the sense it will be Vidankabala, right? So it will be 120 milligram. Okay.
Yes, ma'am.
So like the Sharangatara Samhita, he has said it's exactly the same. Like 1 death is 125 milligram. Only 5 milligram difference is coming. So newborn it will be nearly 120 milligram. Okay.
Yes, ma'am.
The dosage we have to give medicines, that the dose of the medicine to be given will be equal to 120 milligram.
Yes,
Then
ma'am.
for growing child, it should be gradually increased every month, as been said by all acharyas. And this 1 vidanga, it should be mixed with the honey and grida. So there are always a controversy regarding the dosage of honey and grida. In some, it is said that the honey and grida has to be given in equal quantity, whereas in others, they have said in unequal quantity. So there is still an ambiguity regarding that. Okay.
Yes, ma'am.
The quantity of 1 amalaga is a maximum dose. So amalaga, the amalaga, 1 amalaga weighs about 4 grams. So the maximum dosage is said to be 4 grams. Okay.
Yes, ma'am.
Okay. Next, coming on to the dose of grida. So dosage of different drugs according to the age is mentioned in Kashyapa Samhita. Khila Stana, you have Kashyapa Samhita with you, right?
Yes, ma'am.
So just open that.
Third chapter, ma'am.
Yeah, third chapter. You have you read? Have you learned that?
Yes, ma'am. I'm just read once time, ma'am.
Okay, fine. So you so you know the dose of grida? Regarding the dose of grida?
No, ma'am. No, ma'am.
Third chapter, the important one is the dose of grida, right?
Yes.
So we'll say the weight veshaja matram to sheyamana uttrodram. Jada matrasya matrasyat sarpirsha kolas asti samvidam. Pancharatram bhavet yavat dashaha adigam taha tadaha kola artha samvidam yavat vimshat artramadaha param. That is, the dose of grida for immediately born will be equal to the kernel of jujube. In the sense, kola asti samhita. So what is the weight of the kola asti? I had mentioned it now, right? What is the weight?
280 mg, ma'am.
280 mg. So that is the grida dose should be of equal for a newborn should be of 280 mg. Kola asti samhita. Okay. Afterwards, up to 5 or 10 days, it becomes slightly more. Then up to 20 nights, it should be equal to that of the half jujuba. That is, half means kola artha samhita. So kola artha it will be equal to half gram. Okay.
Yes, ma'am.
Kola artha samhita. So up to 20 nights. It will be increased afterwards up to 5 to 10 days. And it will be increased slightly more. Then up to the 20th night, it should be equal to that of the half kola artha samhita, half jujuba fruit. That is half gram. Okay.
Yes, ma'am.
Dikola samhidam sarvis tridiye masa shasyade. Wait. So it goes like Panjaratram bhavet yavat dashaham adigam tadaha. It should be increased slightly more up to 5 to 10 days. Again, it is increased up to the 20th day. Kolartha samhidam yavad vimshadatra madaha param. Up to the vimshadratra madaha param. Up to the 20th night, it should be of dose of Kolartha samhita. Got the point?
Yes, ma'am.
Kola matram bhaved yavat masam masadvaye atike. Till 1 month, it should be equal to the kola. Kola means what is the kolamatra? It should be 1 gram. Okay.
Yes, ma'am.
So kolamatram bhaved yavan masam adhikam. In the second month, it becomes more than this. Dvaye adhikam. Masatvaye adhikam. On the second month, it will be increased little more. Panjame mase shashte cha hi ardra amalaka samhidam. So on the and on the 6th month, 5th and the 6th month, the dose will be equal to that of the ardra samhidam. That should be equal to the ardra, that is the green fruit, the fresh fruit of amalaga. The fresh fruit of amalaga weighs about how much? 4 grams.
4 grams.
Okay.
Yes, ma'am.
Shushka amalaga is 2 grams. The ardra amalaga, it will be 4 grams. Okay.
Yes, ma'am.
Up to 4th month, it should be of Shushka amalaga, that is 2 grams. Then it is doubled. On the 5th and 6th, it will be ardra amalaga, that is equal to approximately equal to 4 grams. Okay.
Yes, ma'am.
So this is the dose of the krida. Again, Shushka amalaga. Tadvid Tadeva apyadigam kinchit vihanti saptama ashtame. That is in the 7th and the 8th month. It should be more than this. Tadeva apyadigam kinchit vihidam saptama ashtame. Kshira annadasya balasya prayena ahara sankarat. Bhavanti niyado vannim. Pakto vanni anilatmanaha. Tasya apneya vekshigi tasmat sneha matra vidiyade. That is the digestive fire of the Kshirannada. Kshirannadasya balasya prayena ahara sankarat bhavanti niyado vannim pankto bahu anilatmaham. Bahu anilatmaha means the digestive fire of Kshirannada having predominance of Vayu is irregular due to the consumption of mixed diet. So that is why the dose of the oleaginous substance should depend upon the Agni. This is very important. Okay?
Yes, ma'am.
So I'll repeat. Kshira annadasya balasya prayena ahara sangarat. That is, since the diet of the Kshira annada, because he is having milk as well as some anna also. The solid foods as well as the liquid foods are going for him in an equal quantity. In that form, the Agni will be varied. Bhavanti niyado vannir. Pankto Bhakwa Anil Atmaka. And the Vayu, the predominance of Vayu will be there, and that is also in a regular form. Tasyat Aknya Vekshigi Tasmat Sneha Matra Vidiyate. So after carefully looking after the dose, then only we have to administer the oleaginous substance. Okay?
Yes, ma'am.
In case of Annada, the annadasya tu bhuvishtam samo bhavati pavaga. That is, in majority of annada, the fire is in an equilibrium. That is, he has attained. That is the reason why that is the reason why it is the solid foods are continuously given. Like the food diet is totally changed in annada to solid food, since the fire is stable in him. Digestive fire is stable. So annadasya tu bhuvishtam samo bhavati pavaga. Tasya amalaga matrasya sarpisham pana vishyade. That is, since the fire is in equilibrium state to him, the desired dose of grida to be ingested is equal to the fruit of amalaga, that is 4 grams. Okay?
Yes, ma'am.
Annadasya tu bhuvishtam samo bhavati pavaga. Tasya amalaga matrasya sarpisham panam ishyade. Tadeva aknibalam vikshyam vardhamanasya vardade. Kshiravasya kumarasya Shira annadasya chobhaya. That is, looking into the strength of the digestive fire, the dose of the grida should be increased in growing Shirava and Shiranada, or in case of both. Okay?
Yes, ma'am.
That is, according to Agni, the doses should be determined. And Deyam Sneha Chadurbhagam Beshajasya Yadamayam Kridena Paye Balam Yavat Syad Ashtamasigam. Till the child is of 8 months, 1/4 quantity of the drug to that of the oleaginous substance according to the disease should be given for drinking with the grita. After the 8th, the levigated with water should be given to the human beings. That is, Deyam Sneha Chadurbhagam Peshachasya Yadamayam Kridena Payayet Balam Yavat Syat Shastamasigam Masadado Ashtam Jandur Jala Pishtam Pradabet Adaha Param Yada Shastram Kumarasya Anna Sevina. So, up to the 8th month, half the quantity of the drug to that of the oleaginous substance according to the disease, it should be given. That is the quantity for the preparation. The half the quantity of the drug has to be used. After the 8th month, the drug should be levigated with the water to the should be given to the children. Okay, so this is according to the. This is the idea regarding the dose of the grita. Okay.
Yes, ma'am.
Then coming on to the dose of the churna. Dose of churnanam Deebaniyam amesham matra vidhiyade. Wait one second. Adirasya pramanena samedavyam chikitside agraparva anguli grahyam churna matram tu panina. Did you find that line?
Yes, ma'am.
Can you explain regarding that?
Yes, ma'am.
Have you
Atrasya Pramanen Samvetam Chikitsyate.
Samedavyam chikitsade.
Yes, ma'am.
Okay, tell me. In that, the treatment according to the disease, the drug should be like the treatment according to the strength of the disease. The treatment should, according to the strength of the disease, the treatment should be given. Agra parvanguli grahyam churna matre tu panina. Churnanam deepaniyam amesham matra vidhiyade dviguno jivaniyanam tada samshamaniyasya cha. Okay, in that it is said like the dose of the drug should be equal to that of fistful, one prekunja, one prastha or one anjali should be given. How much is one prastha? Any idea how much is one prastha?
No, ma'am.
Okay. One prastha means
16
2.5 kg. Oh?
192 gram, ma'am.
One prastha is. Are you sure it is 180 gram?
192 gram, ma'am.
Okay. One prastha. It's 700 something, right? Are you sure? I'll just confirm it and I'll type.
Yes,
I have a doubt now. So it will be, so as I said, one prekunja, you know how much is one prekunja? One anjali, how much it is?
384 gram, ma'am.
Yeah. Okay. So that is right. So I'll just confirm and I'll tell you. Okay, I'll just tell you in the next slide. What we were telling, the dose of the powder, it should be equal to the quantity. The dose of the powder, that is dose of the churna in the quantity, it should be held in between the 4 phalanges of the 2 fingers of the hand. This dose is said to be, again, the dose of churna, it is according to the mode of action. It is divided into 2, wherein we find like divided into 3. That is, the dose is said to be of this is the dose said to be the deepaniya. Deepaniya, it should be of 1 pinch full. Am I right? The dose of the powder in the quantity should be held in between the 4 phalanges of the 2 fingers. That means 1 pinch. That is deepaniya. That is that which causes deepana. Double to this is the life prolonging or pacifying. So in case of Jeevaniya as well as Samshamaniya, it should be of 2 pinch. Okay?
Yes, ma'am.
And the dose of the emetics and purgative is half of this. That is, again, it is 1 pinch only. Am I right?
Yes, ma'am.
So that is what it is being said. Adirasya pramanena samedavyam chikilsidam Agraparvanguligrahyam Churnamatretu Panina Churnanam Deepaniyam Esham Matra Vitiyade Digunam Jeevaniyanam Tada Samshamanasya Cha Urdhva Bhage Tat Urdhva Matram Tadeva Cha Virejana Vada. Okay, then coming on to the, for the Vamana and Virejana, it should be half the dosage. Coming on to the dose of the Kachaya. Okay, the dose of the Kashaya, it is said like Vada Pitta Kabaknanam Kashayam tu Pradabet Dvau Dabayet Prasrado Sharkara Madhu Samyudo. That is, in decoction capable of eradicating Vada, Pitta and Kaba, 2 Prasrada, powder of drugs, along with the sugar and honey should be mixed. Okay?
Yes, ma'am.
Any doubt?
No, ma'am.
I have a doubt regarding the Prasrada actually. Yeah, Prasrada is actually 160. Prasrada is just 160 grams. Okay?
Yes, sir. 160 grams.
So, the Prasrada means it is 1 kudava. That is 320 grams.
Yes,
that much should be the drugs used for preparation of Kashaya. In that, we have to mix sugar as well as honey. Okay?
Yes, ma'am.
So, again, I'll repeat. Vada Pitta Kapaknanam Kashaye tu Pradabayet Do Dabayet Prasrudo Sharkara Madhu Samyudo Prasradam Chardaniyasya Dvigunam Jeevaniyanam. Okay, Do Dabayet Prasrudo Sharkara Samyudam. So, in case of Jeevaniya and Samshamaniya, Prasradam Chardaniyasya Nishkwadasya Pradabayet Tada Vairejaniyasya Prasradam Na Atra Samshayam Dvigunam Jeevaniyasya Tada Samshamanesya Cha Deepaniyasya Kalkam to Akshamatre Prathabayet. So, in that case, 1 Prasrada of emetic decoction should be given. The same 1 Prasrada is for the purgative. There is no doubt in this. Of lifelong prolonging decoction, it is double to this decoction, and same is a pacifying. So, in case of Jeevaniya and Samshamaniya, it should be a 4 Prasta, and in case of Vamana and Virejana, it should be 3 Prasta. Right?
Yes, ma'am.
Any doubt?
No, ma'am.